Mr. Bosling. My name is Brittany, and I'll be your student physical therapist today. How are you doing?
Doing good. How about you?
Doing well. All right, so I just kind of want to tell you what we're going to do today. So the first thing, I'm just going to take all the information that you've given us. Thank you for that. And kind of figure out what's going on, write all this information down. And then we'll kind of go into the physical part of it. So I'll be testing some of your muscles, seeing how your body's moving, so we can figure out the best plan of care for you. This first part should take about 15 minutes, and the rest maybe 30 minutes, and then we'll get you out of here as soon as possible. Is that all right?
Sounds great.
Perfect. Have you ever been to physical therapy before?
No, I haven't.
Okay. And how old are you?
I'm 25.
25. All right. Okay, and what do you do for a living?
I'm actually a postal worker. Yeah.
Nice.
Yep, government job.
All right. And what does that look like? Talk about an average day.
So, I mean, contrary to popular belief, I do actually walk a lot. Well, I do a lot of sitting too, but
yeah.
So I walk about 4 miles a day. Yeah, it's crazy. And then I sit for a long time too. Going on my way to like drop off the mail and stuff. So
okay.
It's about several hours a day.
So you're walking about 4 miles. That is a lot. How many hours a day do you work?
I'd say a full work day, probably like 8 hours.
And how many days a week do you work?
6.
All right. And how is what's going on right now affecting your job?
It's kind of hard, yeah. It's really like strenuous, I would say. Brings on that pain, and it's just hard to get through the day sometimes without any pain at all. So.
Absolutely. And that can be frustrating because we all have to work.
True. I need money.
So what are your hobbies, or what things do you enjoy?
I really, really, really like CrossFit. Yeah, I'm really big into it.
How long have you been doing it for?
I'd probably say about a year.
Okay.
Yeah.
And how often are you doing?
3 days a week.
3 days a week?
Kind of hard with the whole 6-day work week, so.
For sure, but at least you're staying really active with the walking the 4 miles every 3 days. That's awesome.
Thank you. Trying to work on my fitness.
And are there any community activities that you're involved with as well?
No, the CrossFit is really cool. It's helpful in the community that way, so I'd say that's about it.
We do great social.
Yeah.
Do you guys do a lot of social stuff together?
Oh yeah, we go do a lot of stuff together. And we have events too, like our WADs, they're reference people throughout our community stuff. We'll help anybody that needs help.
That's awesome.
Raise money and stuff like that. So it's a great community.
That's awesome.
You know?
It's always great when you find a group of people that you can relate to.
Yeah, for sure. I agree.
All right, so you do that. All right. So can you tell me just a little bit about what is your living environment like?
I got a match pad, 1 story. I don't have any stairs or anything like that. And yeah, I have a dog. Just me and my dog.
What's your dog's name?
Penny.
Penny. Awesome. So not a lot of walking or climbing stairs. That's really nice. Have you been using any assistive devices, so canes, walkers, crutches, anything like that? Neck braces or anything like that?
No, I just use the brace when I lived at CrossFit, but that is
okay. Perfect. All right, so what brings you into PT today?
So I got this pain. It's right here, and it's a shoulder blade.
Okay.
And then kind of my lower neck. It's not really high. It's right about there.
Okay. And how would you describe that pain?
It's there all the time, I would say.
All the time?
Yeah.
Is the neck all the time, or is the kind of by your shoulder all the time?
They're together there all the time. Yeah.
Both of them are all together. Okay. Do you, if you could rate your pain on a scale of 0 to 10, 0 being no pain at all, 10 being worst pain, need to go to the ER immediately, how would you rate your pain right now?
I would say it's at 3 right now.
Okay.
Yeah.
And what about at its absolute best?
1.
Okay. What about at its worst?
At its worst. Probably like a 6.
Okay.
It's not too terrible, but I mean, it's there for sure.
And how do you feel the neck and the shoulder kind of relate? Does one come on before the other?
I would say they both kind of come on at the same time, but then sometimes this like other pain like comes, not, I wouldn't say pain, I guess I would say like numbness and tingling comes in. And it just like, that'll come on after this comes on.
Okay. So then you have pain that goes down to your hand. That was the next question I was about to ask. So do you have pain, or where exactly do you have pain down your arm?
Like here. It doesn't really, yeah, it doesn't, it just kind of comes on. It's like what I said, when that comes on here and it gets worse, that's when like this starts to come on. And it's just boom, right there.
Any specific fingers?
This one, and then I would say like around here. But
Okay.
just this finger.
Okay. All right. And do you have any symptoms going down your left side? All right. What about going up your neck, higher than where your pain is now? All right. What about on your back, kind of lower? Okay. And anything in your legs, either one? Okay. Gotta check off all the bases here. What about anything on the front part of your body, other than that? Okay.
Just that hand.
Just that hand. All right, so I'm just gonna ask if you wouldn't mind. This is a body chart. So I've got right here and right here is where you're feeling your pain.
Yeah, that's perfect.
All right.
Spot on.
Yeah, it's better to look at it than me miss something.
Thank you.
Yeah. All right. So can you tell me about what type of activities make your pain worse?
When I look down, so sometimes, you know, when lifting and stuff, you know, I look down and it just, that hurts. And then if I'm looking to my right, because you know, I'm the postal driver, so it's like looking to my right, that hurts. And then like sometimes, like, because I don't sneeze all the time, but like when I do, it's like, that hurts. That does not feel good.
Okay. Can you kind of rate those as those pains? So when you said you look down, kind of does it? Can you describe how that happens when the pain comes on?
So like whenever I like immediately look down, boom, pain.
Okay.
And that's probably, I don't know, it hurts not too bad, but I would probably say like a 4.
Okay. And what about when you kind of turn your head side to side?
It's gonna be the same thing on that.
Okay.
Probably like 4.
All right. And then you said lifting?
Yeah, and then that sneeze, that kills. It's like immediate, like as soon as I do it, and then when I lift too, it's hurting, and it's probably like a 6.
Okay. That's uncomfortable. I'm sorry.
Yeah, it's not fun.
So what kind of so when those pains do come on, what kind of things do you do to help ease them?
Okay, so like I kind of have to like get all situated, sitting straight up, and then like it'll start to kind of ease and go away.
About how long does that take?
2 minutes.
Okay. And then what other?
I really like to like sit there and massage like that area, this area up here, and it feels really good. Yeah.
How about how long are you doing that for?
Probably like 5 minutes.
5 minutes?
Yeah.
Wouldn't it be nice if you just have somebody
All the
permanently just doing that?
time. Yeah. I would love that.
I would love that too. All right. And what about kind of when the first thing you wake up in the morning? How is it feeling?
It's not feeling too good. Yeah, it's probably like honestly like worse in the morning.
Worse in the morning?
Yeah.
What about like midday?
It gets better. Yeah. Like as I move around and stuff.
Okay. And then what about at night time? So after you've come home from the day?
It's not too bad. But when I'm trying to like lay down, it's kind of like hard to get in a good position.
Okay.
But that's about it though.
Does it affect your sleep at all?
Once I'm asleep,
That's good. You gotta have that sleep.
I gotta have sleep for work.
I'm like, I would not be okay with it. All right, you filled out a medical history form, so thank you for that. It really helps us. I just kind of want to go through it to make sure that we're on the same page. So basically what I'm seeing is you checked yes to bothered by little interest or pleasure in doing things, and it's talking about workout. Is that your main kind of factor why you're having little interest, or is there anything else?
I just like really like all into CrossFit.
Yeah.
You know, like I'm just really into it, and like that's what they ask you, that you gotta buy in, and then you give like your all to it. And so it's just hard right now, you know?
For sure.
And I really just like want to get back to what I'm doing, and I want like everybody to kind of like be there with me, you know?
Yeah.
Yeah.
That's definitely one thing that PT is really good about is we want to get you back out as fast as possible, and we want to teach you so you don't re-injure yourself in the future, because then what's the point? So it's got to be really frustrating, and I definitely can see, like, especially having all those great friends.
Yeah, it is good. It's just really a good overall environment. So PT is a little bit, you know, I haven't done it before, like I said, and I just don't think it's as intense. So I'm kind of just, you know.
Yeah, for sure. And we'll definitely kind of go through each process, and I'll explain it to you. And at any time, you know, you're thinking we're not doing something, maybe there's a reason, and I can explain that if that's the case. Totally know. Sometimes we're doing some exercise and you don't think anything's happening, and then like a day later you're really, sore in that area.
Maybe.
Yeah.
That'd be good.
So I'm also seeing that when you cough, sneeze, those kind of things are, like you said earlier, is like your immediate pain.
Yeah.
Are you having any bowel or bladder?
Not really that I noticed. No.
Okay.
Seem pretty. Okay.
Okay. All right. And you have had imaging. All right. And what did the doctor say?
Really nothing. He said it was good to go. So.
About how long was that taken?
I'd say about a week. Yeah.
Okay. And then I also see on here that you are taking ibuprofen and Robaxin. Are those working for you?
I think so. Yeah, I think you're a pretty good job.
All right, and I see that you kind of your learning style is kind of mixed, kind of seeing, doing, hearing, all that stuff.
You know how CrossFit is. It's just like, you know, kind of like they teach you some stuff really quick, but like, you know, as soon as you just gotta go to it. So
For sure.
it's a little bit of both.
So really the reason why we asked that question is because we want to make sure that we teach you the best way that you learn.
Yeah.
So I know it's like a random question on the form.
Yeah.
So I always like to explain that because it's really important that we make sure that you understand the movement, so if we need to get printouts or whatever we need to do, that we get that done for you so it's more effective. Okay. All right. So basically what I would like to know is, and I don't see any, for the last thing on the health sheet, I don't see any like history of diabetes, cancer, and that's true? Okay, perfect. All right, so how did you injure yourself?
So like, you know, in CrossFit, I was doing that, and you know, it's been pretty intense lately, really getting after it as a team, and then about 2 weeks ago, I'd say, I woke up and it was just like, bam, like it just immediate pain, it felt like, and so it kind of just started, and that's when it kind of, the scap pain started to come on too, and it just started hurting. So I went to the doctor that day, and I got some, those meds I told you about, and then I got some kind of injection too, I think it starts with a T.
Okay.
Toradol, I think. Does that sound pretty familiar?
Yeah, that sounds familiar.
Okay. And then, yeah.
Did that work?
Yeah, I mean, for the time being, but then it just came back on.
Okay.
So I would say that it did its job, but maybe not well.
Okay. Should be good. You get that. And do you feel that, I know in the intake form you said that you don't feel like it's getting any better? There's no changes? Is it getting worse, better, or just no changes?
No, it's just no changes. It just kind of stays the way it is, unfortunately.
It's frustrating.
Yeah.
Like you want to see something.
Even enforcing. That would kind of be, at least I know, you know, but it's just staying there, so.
Correct. Yeah. Okay. And have you ever injured kind of your neck, your...
No, not that I can remember.
Okay. And then you said that you started feeling kind of like your, right by your scapula, so right up your here. Did you immediately start feeling the kind of numbness and pain in your hand?
No, that started like, probably honestly about like 3 days ago.
Only 3 days ago?
Yeah,
okay.
And that's when it kind of started coming on, and it's been bugging me.
Yeah.
For sure.
So that was kind of like after you had gone to the...
Oh yeah.
Okay. And so did you let your doctor know that that had come on?
Well, I wasn't really there right then, so he doesn't really know about it, but no, I wasn't telling you, so.
All right. Good. So, so no history of ever having like numbness and tingling or neck or back pain at all? Okay. All right. want to know from you is what kind of are your goals for coming to physical therapy?
Well, one, I just really want to be able to like move around without having to like catch or like anything like that. I don't want any pain when I go through work, and especially for workouts and stuff.
Yeah.
And then I want to be able to get back to doing CrossFit like normal. So
For sure. Okay.
Yeah.
So got getting that motion back, and then returning to your
that's like
CrossFit as soon as
big
possible. Okay. Is there anything that you feel like might help with your recovery process that we can make sure to include?
Yeah, like I said, I'm still kind of questioning the physical therapy thing, like how good it can help me, because I feel like CrossFit's like, really high up, and then physical therapy's kind of like, you're hurt, like you're not doing that much intense stuff. So if I could, like, hopefully, have you just help me with like intensity stuff. Like I know I'm gonna have to be doing some smaller exercise maybe, but like just help me like be in the mentality of intensity, I guess.
Yeah.
Just to kind of help me through it.
So as we go through, like we might have to start a little bit slower, just because of injury. We want to make sure that we don't cause it to get any worse, or cause you to re-injure something else. So definitely it can be a struggle for some people because they don't think they don't feel like they're doing anything.
Yeah.
So just whenever you're feeling that, let me know and we can walk you through like what's happening. Especially if that's kind of like stuff that's interesting to you.
Yeah.
I can explain it a little bit further, and then we can kind of go through. But yeah, it's not as intense as CrossFit for sure because it's just a little bit more therapeutic workout. But we want to get you back to getting out there as soon as possible.
All right.
But yeah, okay. So thank you for that.
Thank you.
So basically, this is the last question that I have. Thank you for sitting here with me, going through all of that. What questions do you have, or is there anything you feel like I've left out?
No, I think we hit it all, yeah.
All right, perfect. So what we're going to do is we are going to start the kind of physical exam part of the time here. So let me just get my notes all together. So right now, just sitting here, what do you, if you would rate your pain with that same scale?
I'd probably say it's like a 4 right now.
A 4?
Yeah.
Okay. All right. So what I want to do is I'm gonna kind of like look at your posture, see how you're sitting. I know you were talking about how sitting up straight helps it. So just kind of see kind of like your normal, and then I'm gonna get you to walk for me.
Cool.
So if you just want to kind of, how are you sitting while you're in your car?
Probably like a little bit like this.
Okay. So that's good. Now what I'm going to do is ask you, I want to see you kind of walk, we're going to walk a runway. If you wouldn't mind taking off your socks and shoes for me, as well as your shirt, so I can see kind of right where the movement is and where your pain is.
All right.
And first thing I'm going to have you do is just stand right in front of me, and then we'll do a little fashion show.
Okay, perfect.
All right. You can just hang your arms by your side. Perfect. All right. If you want to go ahead and turn towards that wall for me. And go ahead and face. Perfect. All right, and last but not least, face towards here. Okay, perfect. All right, if you want to come back over here. So I want to just kind of see you walk straight to kind of the end of the table and then to come back towards me. And coming up over. All right, perfect. All right, you want to just come right over here. So if I just want to kind of see your movements in your shoulder, so if you just want to go ahead and raise your right shoulder as far as you can and relax, how does that feel?
Feels pretty okay.
All right, if you want to go ahead and do that again, and at the very end, I'm going to apply just a little bit of pressure. right. And relax. How does that feel?
Good.
All right. Any pain?
Mm-mm.
Okay. All right. So I want you to kind of do the same thing with your right. What do you feel?
Good.
All right. Okay. Go ahead and do it again. I'm going to do the same thing on this side. And all right. How does that feel?
Good.
All right. Perfect. The last two motions that I'm going to have you do right now is I want you to kind of put your hand on kind of your backside, and I just want you to, while touching your leg, is just kind of slowly bend kind of backwards. It's going to be kind of an awkward motion. And once you get to the point, come back up.
Okay.
What do you feel with that?
Fine.
All right. Now I'm going to want you to do that again, and I'm going to put a little pressure again.
Okay.
Okay? How does that feel?
Good.
All right. We're going to do the other side. How does that feel?
Good.
Okay. And again. And relax. Everything good?
Mm-hmm.
All right. We write some notes. All right. And can you tell me or show me a movement that you do throughout your day that causes your pain?
Yeah, I would say, when like, you know, when I'm driving,
Uh-huh.
I have to look over my shoulder this way.
So looking over your right shoulder.
Yeah.
Okay. All right. If you wouldn't mind, go ahead and sit down for me. It's the fun part. You get to sit
Ooh.
and just
Hang out.
I'm gonna lower you just a little bit. Let your feet touch the ground. All right. So what I'm gonna do is I'm just gonna test, since you're having some of that numbness and tingling. I'm just gonna test kind of your senses, how everything's feeling, and then I'm gonna test how your muscles are, and then we'll do a little reflex test.
Okay.
All right. All right. So what I want to do is what I'm gonna do. I'm gonna kind of show you what I'm gonna do at first, so you are aware of what's happening. So I'm just gonna lightly touch both your right and your left. And it is your right. So I'm gonna start on your left. So basically what I'm gonna do is I'm gonna say, does this feel the same as this? And I just want you to answer. If you need me to repeat it, you can always say, just repeat.
Okay.
All right? Okay. So this is gonna require me to touch you again. Is that all right?
Mhm.
Okay. All right. So does this feel the same as this?
Mm-hmm.
Does this feel the same as this?
Mm-hmm.
Does this feel the same as this? Does this feel the same as this? Does, if you could put, there we go, sorry about that. Does this feel the same as this? 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 All right, perfect. All right, so what I'm gonna do is I'm gonna go ahead and I'm going to test some of your muscles. So the first one I want you to do is I just want you to take your chin to your chest. Okay. And relax. How does that feel?
Not a little bit of pain, but
Okay. So I'm going to provide a little resistance. Don't let me push you back. Okay. All right. So come forward and hold, hold, hold. All right. So the next thing I want to do is I'm going to kind of put my hands right here. Just go ahead and look to the left, and then we'll go to the right. And don't let me. So sorry. Get a little closer. All right. Go ahead and go to the left. Don't let me push you back. All right. And let's go to the other side. Hold, hold, hold. Perfect. So now we're going to do the same thing. Is you're going to come to your shoulder, and I'm going to try to push you apart. All right. And hold, hold, hold. Let me know if you feel any pain with this. Let's come to the other side. Hold, hold, hold. Perfectly. Now I want you to raise your shoulders up high, and I'm going to try to push them down. Don't let me, all right? Hold, hold, hold. Perfect. And I want you to, perfect. Don't let me push your arms down, all right? Hold, hold, hold. Perfect. Now if we want to make a nice fist, flex those muscles.
yeah.
All right. So don't let me pull you down, all right? Okay. Hold, hold, hold. Hold, hold, hold. Now I'm going to push.
Okay.
All right. Hold, hold, hold. Hold, hold, hold. Now if you want to turn your hands this way and flex them up for me. All right, don't let me bring them down. Hold, hold, hold. Hold, hold, hold. Hold, hold, hold. Now come down. All right, don't let me bring them up. Hold, hold, hold. Hold, hold, hold. Perfect. Pick your big thumbs up. All right, don't let me push them down. Hold, hold, hold. Hold, hold, hold. Now come up like this. And I'm going to try to pull your fingers, all right? Hold, hold, hold. Hold, hold, hold. All right, come Oh, don't let me push them in.
Hold. Hold, hold, hold. Hold, hold, hold.
It's really hard, huh?
It is hard.
Hold, hold,
Maybe I
hold.
need to work on this in
You
CrossFit.
come together, and then I'm gonna try to pull them apart.
Okay. Hold, hold, hold. Oh man. Hold, hold, hold. Hold, hold. Not so great here.
That one's all hard. All right. So I'm just going to, I'll kind of show you what's going to happen. It's kind of a bouncy motion, and I'm just going to test some of the reflexes of your muscles. If you want to come forward just a little bit for me. All right. If you want to bring your hand and your palm up. Okay. And if you want to put your hand up on your hip. All right, I'm going to do the other side. All right, if you put your hand on your palm. Okay. And hand up on your hip again. All right. And you can relax. Actually, I have 2 more to do. So what I want you to do is I just want to hold one of your right hand, left hand, sorry. And I'm going to just kind of relax and let me do the motion. I'm just going to push it up. All right? All right. Okay. And what I want you to do here is I want, I'm just going to kind of push on your finger. Just kind of relax. All right. I'm going to do the exact same thing on this side. Okay. All right. Perfect. Now you can relax for a little bit. Do you have any questions so far or anything? Okay. So I want to just do a little bit of just testing some, marking down those range of motions, definitely because we want to make sure that we get what's going on right now so you can see how well you do once we get some exercises. I always feel like if I see it, it makes me feel better. All right.
See it? Wait, believe it if I can see it.
Exactly.
Yeah.
That kind of. So what I want to do is I want to have you do first, sit up straight. I'm going to put this up to you.
Okay.
And then I just want you to lean all the way back as much as you can.
Okay.
And then the next one I want you to do is you'll lean forward. Okay? Okay. All right, go ahead and lean as far back as you can. Okay. And we'll do the same thing. All right. And I'm going to do the same thing on the opposite side. It's always weird when you're being measured, huh? All right, go ahead and lift all the way back. All right, perfect, and relax. All right, and go ahead and go all the way forward. All right, perfect. Do you feel any pain with that?
I'm kind of like down, like I said, but it's already gone.
Okay, and it's gone already? Okay. So we're going to do rotation because you're definitely, when you move your head side to side, you were saying that that's really painful. So I'm going to use this larger one. So don't be alarmed. I'm going to kind of get up here because I can't see. Okay. So what I want you to do is, in a minute, just go ahead and look towards your left shoulder, and then go ahead, then look towards your right shoulder. Okay, whenever you're ready. Any pain with that?
No, this one's okay.
All right, you can come back to normal. All right, let's go to the other side. Whenever you're ready. And relax. Any pain with that?
Yeah, that one hurt a little bit in that same area.
So it hurts how?
Just that constant, like how it kind of comes on.
Okay.
Yeah.
I'm seeing a little bit less rotation, maybe just because of that pain, so I totally understand that. All right. to do is, so we kind of look to side. We've worked forward and back, but now I want you to kind of lean your head to the left and the right.
Okay.
So I'm going to move your hair real quickly so I can put this where it needs to go, so you'll feel it.
Okay.
All right, so whenever you're ready, what I want you to do is just move it to the left. There you go. What are you feeling?
This one feels okay.
That one feels okay?
Yeah.
All right, and come back to normal. Perfect. And let's do the other side. Let me know how you feel.
Yeah, this one kind of.
Okay, come back after. Okay. So what I'm going to do is I'm going to, you can go ahead and put your shirt back on if you'd like to. I know it gets a little cold in here.
Yeah, just a little bit. It's alright though.
So while you're right there, I'm going to raise this up. Okay, if you want to sit down for me just one more time, what I'm going to do is I'm going to ask you to just kind of sit up, and I'm basically going to just put a little pressure on your head. You'll do a little bit of flexion. I know this kind of hurts a little bit, so we're just going to do slight. Okay. And then what I'm going to have you do is that, and then to the right.
Okay.
Okay? Because we want to test that, because that's where you're hurt.
Gotcha.
All right, so just sit down a little bit. And I'm just going to press a little bit, okay? Let me know what you feel.
Yeah, I mean, it feels alright. I mean, still a little bit of pain, you know?
A little bit of pain?
Yeah.
Are you feeling any things in your arm?
A little bit.
A little bit? Okay. All right. So now what I'm going to have you do is, this is the fun part. You're going to get to lay down.
Oh, awesome, awesome.
So go ahead and lay down, and I'm going to come on to the other side.
Okay.
Perfect. So what I want to do is I just kind of want to feel right around your neck area where it's hurting. And then I'm going to do kind of 2 more movement tests for you.
Okay.
I can raise this for your comfort right there.
Thanks.
Okay. So let me know what you're feeling. Or specifically right where your pain is.
Probably about around there.
Right there? Okay. And kind of right.
Oh, yeah. That right side. It kind of brings on that numbness and tingling up here in my hand.
Okay. Coming around to the other side.
Alright.
So I'm just gonna have to move your shirt back here.
Okay.
And this is right where you were saying?
Mm-hmm.
Okay. So I'm just gonna apply a little pressure.
Okay.
Kind of just seeing how we've got some, I know it sounds weird, we've got some joints back here.
Uh-huh.
So I'm just gonna apply a little pressure to see how it's moving. You let me know what you feel.
Okay.
Any pain. Okay. How are you feeling right there?
I feel alright.
Okay. How about right here?
Yeah, that red side.
That's where you're
Yeah.
feeling?
Yeah.
Okay. What are you feeling?
It's just that little bit in my, shoulder blade area, and then it's bringing on that numbness and tingle.
Okay. Okay. All right, if you wouldn't mind, now go ahead and flip to the other side with your head up, and I'll put this, sorry I don't have a pillow right here for you. That's not nice of me. All right, what I'm gonna do, I'm gonna raise this table, as it takes forever. All right. So I'm gonna go ahead and raise your head, just kind of allow for me to kind of move your head. Don't try to fight me. Okay, sorry, I'm trying to get around your hair. All right, so what I'm going to do is I'm going to kind of apply a little force towards me. You let me know what you feel at any ever time, okay? Do you feel better, feel worse, and then kind of describe it. Okay? All right, how are you feeling?
I felt good.
That felt good?
I didn't feel like it kind of went away.
Okay.
Yeah.
Where did it go away from?
This area.
Okay.
Yeah, I didn't feel that numbness and tingling anymore that I felt when I was on my stomach.
Okay. Awesome. Okay, so I have one more fun test for.
Awesome.
Okay, so I'm gonna write. Oh, I'm so sorry. That always happens. Good thing my leg was right there. True.
It would have been fun either way. I would have lived.
When you're in tight quarters, you never know. It takes forever.
It does. We have one of these at the gym.
Okay. If you want to go ahead and place your feet onto that side, and I want you to bring your shoulder out here as possible. And I'm going to move my clipboard over here so I can step back here. All right, so what I'm going to do is I'm going to just kind of move your arm, and we're going to kind of see what the feelings are. And there's going to be a certain point where I'm just going to ask you to move your head away.
Okay.
So what I want you to do is I want you to take that ear to that shoulder at that time, and then you'll come back, and then you'll do it to the other side.
Okay.
Any questions? All right, perfect. You can come out a little bit more towards me. Perfect. Okay. Sorry, I'm going to manipulate your hands right
You're
now.
fine.
Okay. How are you feeling right now?
I'm feeling it a little bit.
You're feeling a little bit?
Yeah.
All right, if you want to go ahead and move that shoulder.
Yeah.
And come back?
I definitely feel it.
And what about come back to your right shoulder?
Yeah, it goes away.
Okay.
I do that.
And come back. All right. Okay. All right, if you want to go ahead and sit back up for me. Now, if you just kind of figure out how you're feeling right now after all of that's going on, how are you feeling right now after getting up from that numbness and tingling?
Honestly, probably about like a 3.
A 3?
Yeah.
Okay. Are you dizzy at all? Any numbness? Okay. All right. So basically, just kind of talk through what I feel like we could do for you, what would really help, and then kind of do a little bit of treatment today.
Cool.
And then, so what I'm feeling right now, so we've got all these nerves. You're familiar with those?
For sure.
And their main hub coming from the spine, and sometimes there's so many bones, so many things going on there. Sometimes those nerves just kind of get a little bothered.
Okay.
They get a little mad. Or and that's why you're feeling all your symptoms kind of like come down into your hand.
Gotcha.
So what we're gonna do is I'm also seeing kind of like the motion of your neck is a little bit limited. So we're going to work on that and hopefully get all those numbness and tingling coming back in its place where it should be.
Gotcha.
And then we're going to kind of work on making sure that I know you're walking and you are driving for long periods of time as we're really working on that posture. So what I want to do is probably with your schedule, see you about 2 times a week. If you can, for about 8 weeks.
Yeah.
And then we'll kind of like reassess as we go to make sure that you're getting the best. What questions do you have at this point?
No, I think that'd be pretty good. I think I can make twice a week. I think if anything, I might just get some CrossFit in order to get better because it seems like it's gonna help. So.
No, absolutely, and I know that's frustrating. And what we'll try to do is we'll try to find some modifications and make sure that we work on those things that you're wanting to do to get back out there.
That'd be awesome.
So for the first thing that I want to kind of do for you today is just make sure that when you are driving, or you're walking, certain things like that, that maybe you are stopping and stretching, or when you're sitting, making sure that you're, I'm going to lower you down just a little bit so you can put your feet on the floor. All right, so what we're going to do, this is always really relaxing for me, so it's kind of nice. So I want you to go ahead and I want you to rotate. It's kind of like rocking your hips forward and backwards. So I want you to kind of do that a few times. Kind of helps sometimes in the lower back too, until you kind of find that middle place where you're kind of balanced. We're not used to that. We're not used to activating some of those muscles and getting them working. So once you find that middle place, just stay right there, and then I want you to take your shoulders up to your ears, back, and then down in a very nice, like, relaxed position. Now I want you to take a good 2 to 3 breaths, nice deep breaths in. And a little again. Now we're going to relax, and you can go ahead. And we're going to do that. We'll do that one more time. And what I want you to do is I'm going to print out information for you so you can take home to do an exercise at home. Now that will help you get better, faster. And so we'll do that pretty much if you're driving, or if you're stopping, doing stuff at your lunch. That's something really good to do several times a day to kind of like just let your mind know, hey, I need to fix this. I need to work on sitting up straight and work on your posture. So we'll do it one more time. Okay. So what you do is go ahead and rock your hips back and forth until you find that happy medium. Perfect. Go ahead and take those shoulders up to those ears as far as you can. Go back and then down, and then we'll take those nice 2 long deep breaths. And awesome. All right, and the next one you're having some issues with the right rotation that is causing you pain. So what I'm wanting you to do is we want to work on that, because obviously you need to be able to look over, because driving and doing this is not super safe. No. So what I want to do is I want to start working slowly on moving it. So I want you to go ahead and put your hand on your chin, and we're going towards the right side. Okay. So I want you to slowly go towards your right side until you feel kind of the start of the pain, and hold it there. Okay. And we'll hold it there for about 30 seconds. How are you feeling?
It feels like a good stretch, for sure.
And go ahead and relax. Today we're just going to do the right side, but this is another exercise you can take home and do it there. Okay. And I would do both sides just so you feel more, not like a fiddler crab.
Yeah, that'd be good.
Yeah, so let's do it 2 more times. So let's go ahead and take that right arm to that right chin. How are you feeling?
It feels good. Yeah, it feels better now.
Okay. And go ahead and relax and come back. All right. And we're going to do it one more time. And sometimes, you can challenge yourself a little bit to kind of go a little bit further, but don't push it to the point where you're in a lot of pain or you're feeling that hand tingling. And go ahead and relax. This one usually, your right one, usually when you're doing rotation, goes just to your back. So if you start feeling a lot of pain, you let me know. Okay. Now the other movement that you were having problems with, which is not necessarily so important for you to drive in, but it's good for just normal neck movement, is your side to side movement. So your side going to your, So what I want is it the same thing. So I want you to go until, take your ear to your shoulder, right until you feel just you're feeling that good stretch. And I just want you to do it for 30 seconds. We're going to relax. Just feel that stretch. And if you feel like you need a little bit more pressure, you can go ahead and put your hand on the opposite side and just kind of pull forward a little bit. What are you feeling?
I'm feeling it stretch a lot.
All right. Any pain?
Not really.
Are you feeling anything going down?
Mm-mm.
Okay, all right, relax. And that would be like the perfect place for you to stretch and continue doing that.
Okay.
And so for at first, those are kind of like the first things that I want you to do. Yeah, what other questions do you have?
Nothing. I think that's pretty good. I like the stretches and it really helps, so I can already kind of see an improvement.
All right, so there's another exercise that I know we're not going to do today, but I'm going to give you some information about, and it's being able to do some home traction, and we'll get you probably next time set up for that, because that is one of those things, when I pulled on your head, you kind of felt better. So I just want to give you something of like what we're planning on doing next time.
Okay.
All right, well, if you don't have any questions, I'm going to get you all set up with Leslie up at the front.
Cool.
All right.
Awesome.
Well,
Thank you.
yep.